Hi there, I'm Carolyn Zallmeyer, nurse practitioner here at Low TE, Florida, and I'd like to welcome Dr. Derek DSilva here today with us. And he's a world-renowned doctor, scientist, educator, speaker. He's been on many of the nation's network TV shows. Whenever it's like a question about health, he's the guy they call for the answers. So we're so happy to have him. He's just such a good friend, teacher, mentor, my guru. He really introduced me to supplements, nutritional supplements, and the benefits of them. And he's one of the smartest guys I know. And so he's here with me today to help explain to you why when you come into Low TE, Florida, you come in to get your hormones fixed and you leave with a bag of supplements. It's like, wait a minute, how did I end up with supplements when I came in for hormones? So what we're going to do or try to do today is explain to you how each of these supplements benefit, enhance, and help your hormones work better. They all work synergistically together, and there's a plan there. We're not just trying to get you to take a bunch of supplements for the heck of it. So Dr. DSilva, how are you?
I am doing great. By the
Good.
way, I need to hire you as my PR agent. Okay, so I really
Yes,
appreciate
yes,
that.
yes.
Thank you for that lovely introduction, and you're absolutely right. You know, one of the things that people forget is that the basis for hormones is the ability to make the hormones. So, for example, you need B vitamins in order to make estrogen. You have to make sure that you're taking the right nutrients with regard to the probiotics, the role of vitamin D. What about the whole idea of DIM and what it does? So we'll get into that, and it's not just you're taking a bunch of supplements.
Right.
As you said, it forms the basis. It's the foundation for allowing the hormones to do what they do more efficiently. That's the whole, the whole basis science behind the thing.
Great.
So, should we start with DIM,
Yes.
which is one of our favorites?
Yes, I insist on every patient on hormone replacement therapy, even if you're not on my hormone therapy, this is the most critical supplement you will be taking.
Absolutely.
And I insist on it.
And I totally agree with you, by the way. When I look at practitioners who do hormones without DIM, I immediately know that they've not been trained properly. I don't mean to be so critical, but it's the truth. DIM stands for diindolylmethane. It is an extract from cruciferous vegetables. What it does in a man is that it prevents the aromatization, meaning when you give or you pellet a man with testosterone, there's a chance that some of that testosterone can convert to estrogen. So we want to block that to a degree. And the way that happens is by using diindolylmethane or DIM. In a woman, when you give a woman estrogen, what happens is we want to push estrogen down the right pathway. There are 4 pathways that it can go down. The 2, the 4, the 12, or the 16. We want everything to go down the 2-hydroxy pathway, which is protective for breast tissue, the uterus, the ovaries, the cervix, and you know what else it helps women with? It increases their free testosterone a little bit. And it prevents some of that other aromatization. So very, very important supplement when you're doing hormones.
Yes, and I get some patients get confused because I pellet many couples. Men need to take 2 a day. I recommend it morning and evening, and then if you can only get them in at one time, go ahead and take 2. But for women, just 1 a day does the trick. And this is something when we monitor your labs, we'll see if you're aromatizing into estrogen, and we'll make corrections. But this is your best bet to prevent man boobs, belly fat, feeling lethargic, because men need a little bit of estrogen, but not a lot of estrogen.
Correct.
DIM is a go-to product. Yeah.
You know how I get the men in my practice to take DIM? What I say to them is, and I go right into their face and I say, do you want breasts? If you don't want breasts, you need to take the DIM. And all joking aside, that is what you just mentioned.
Absolutely.
Is the gynecomastia or the production, the men having breasts, will happen if you don't control it properly and do it.
Very important.
Vitamin D. Wow. And there's actually 2 forms of vitamin D here. There's a 5 and there is a 10. So what is vitamin D and what does it do? Vitamin D is it's called the sunshine vitamin. We're here in Florida, and it's you know, this is the sunshine state.
Yeah, but over 90% of my new patients are deficient, even under 30, even in out of the range. I mean, so low. And you'd think with the beach, the sun, boats, all that, we would have plenty of vitamin D, but it's not happening.
Not true. Even I see patients here, as you're absolutely right. I see patients in the Bahamas. I see patients in Puerto Rico. Same thing. Their D levels are extremely low. And you know, D is so important, especially for people up north and even down here, because vitamin D is, you know, people with seasonal affective disorder. Seasonal affective disorder, folks, is a deficiency of vitamin D. Vitamin D, by the way, is real important for muscle strength and muscle growth. The elderly, people that are in wheelchairs, you cannot get up out of a wheelchair if your vitamin D level is low, because you lack that muscle strength and the muscle force to do that. Vitamin D kills the bad cells in our body. So killing those bad cells, it's called apoptosis. That happens also. What's really important here is that the combination of vitamin A, vitamin D, and vitamin K2. So a lot of people, look, we've been doing this a long time.
Yeah.
I first introduced this product about 15 years ago, believe it or not. And I put vitamin K2 with it. Nobody had vitamin K2 with their vitamin D. What I realized was we need a gatekeeper. And that's what vitamin K2 is a gatekeeper. It directs vitamin D and calcium as to where to go, where to deposit, what to do. And it activates two proteins. Those proteins direct the vitamin D and calcium into bone, and the other one directs it into the vasculature, not to the inside of the blood vessel, but to the middle layers of the blood vessel.
Gotcha. So with our testosterone therapy, we're actually helping rebuild bone with the testosterone.
Correct.
So anybody that suffers from osteopenia or osteoporosis, your pellet is your first bet, but we also want to optimize that D because that's going to help with the rebuilding of the bone and getting the bones nice and healthy. And does it help with the immune system at all?
Oh my goodness.
Your favorite.
I completely, your vitamin D, you know, during COVID, the data and the studies showed that people that had the lowest levels of vitamin D had the greatest mortality. And it was very, very dramatic. So, and the reason that we did the 5 and the 10 is there are a lot of people, as you said, that have vitamin D levels that are in the low, you know, below 30.
Right.
Those are the folks that need 10,000. But folks, I'll tell you this. It's very important that if you're taking 10,000 IU of vitamin D, that you're with a practitioner. You must be with a practitioner that can monitor you, because the everyday dose, if you will, the daily dose, the accepted dose is 5,000 IU a day. Once we get into the 60 and 80 range, we can back down to the 5,000.
Yeah, because the reference range on the labs with LabCorp that we use are 30 to 100. We don't really want you on either end. We want you between 60 and 80 because that's where the latest research shows you get your best benefit for your bones, your teeth, your mood, prevention of certain cancers, and even prevention of COVID, and helps with your immune system.
Absolutely.
So it's very important.
And the data on immune health with vitamin D is very substantial. I just there's a friend of mine at Robert Wood Johnson University in New Jersey, in New Brunswick, and he's an endocrinologist, loves vitamin D, absolutely loves vitamin D, and sends me information all the time. And he's a researcher, he's a clinician that does the research, and it's there. The data is very strong.
Yeah.
So, probiotic. Wow.
Somebody's favorite. Here it is.
You know what? This is my number one recommendation for better health. I used to have 4, I have 5 functions now. The good bacteria is responsible for our immune system. 70% of your immune system resides in your gut. It's responsible for digestion. You know, a lot of people will end up fermenting their food instead of digesting their food, and what happens? They get gas. Elimination. I was going to say vitamin D. The probiotic also has to do with increasing what is called peristalsis, meaning the movement of the intestine. So once again, helping with something like constipation. Number 4, it makes most, if not all, of the B vitamins and vitamin K2.
Wow.
It makes vitamin K2. The good bacteria make vitamin K2. But there's one more thing that I've added. The other thing is, and we forget this all the time, the good bacteria make the neurotransmitters in our body that controls your mood. Serotonin, dopamine, etc. are all made in the gut and not in the brain.
Yes.
So I want to share one more thing because I told you as we were preparing for this, I have something new. I was preparing a presentation for a big international meeting, and they wanted me to speak on the role of the gut and aging. And I had just read a study in Nature magazine. I love Nature, absolutely love Nature magazine, because they're about 2 years ahead of what you're going to see in the traditional medical journals. So I read it, and I get it every like two a month. What they showed was that your flora as a young person is very similar to the flora as in the centenarians.
Really?
In between is where you lose the good bacteria. So people in their 40s, 50s, 60s end up losing their good bacteria, and that's when disease and illness starts. We don't know how these centenarians recoup the good
Right.
bacteria
Yeah.
back. But there's a substance that's produced in the gut called butyrate. Butyrate is something that is produced within the gut from the good bacteria, that they have found higher levels of butyrate in people that are centenarians over the age of 100 than people who don't live that long.
Okay, so that's very fancy. We're going to break it down here. What I say when I recommend probiotics, number one, I didn't believe in them when I first was starting to do this. But then I thought, okay, I got to take a deeper dive. Went to a conference and I saw a cross-section of an intestine that had the benefit of a probiotic, and then a cross-section, I have to see things, of one that did not. And the one that had the benefit of the probiotic looked like a plush putting green, the microvilli or in the intestines. And the one that didn't, it looked like a lawn that had a fungus. It was like patches missing the whole thing. And so it just wasn't healthy. And knowing that that's where we're absorbing all our good nutrients from our clean food that we're eating, from our supplements, our hormones are absorbed in there. I mean, there's so much stuff going on there, 70% of the immune system, so much going on in there that we need to keep it healthy. So this is critical. It's
Yeah.
like you said, the one thing that everybody should be on.
Absolutely, absolutely. And you know, you've heard me say this before. We have four grandsons. You know, my oldest son can't stop having babies, and so all 4 boys. You know, our youngest is 1, our oldest is 3. All 4 boys, all 4 children, grandchildren, have been on probiotics since the first day they were born. That's how important this is to me, and it's just such a critical piece of what we do and who we are.
Yes.
But here's the other thing I wanted to share with you. The strains of the good bacteria that are in here, what they showed was that in these centenarians, they needed to have lactobacillus and bifidum. And guess what? We've got 2 strains of lactobacillus in here and 1 strain of bifidum. And that's another critical piece of why I chose these strains for this particular compound.
Well, you have included the 3 most studied
Yes.
microbiota for a probiotic. So that's what's included in this. And it also has a very special patented capsule
Yes.
that reacts to an enzyme in the small intestine, and that's where it opens. Where if you take a probiotic from Sam's Club or Walgreens, you swallow it, it goes into your stomach acids open it, and can destroy all that good microbiota. It doesn't matter how many millions and billions you have, because it's going to get destroyed in the stomach before it has a chance to get to your intestines to repopulate and refresh and make that lining nice.
You know, Carolyn, you've done very well to remember all of this, because seriously, Yeah, I completely. Again, I didn't. I get so involved in the minutia that
He goes
that
a little
delivery,
deep.
that delivery technology
Yeah.
becomes critical because
Oh,
if you
yeah.
don't have the right delivery vehicle, it's not going to work.
Right.
So you're
Yeah,
absolutely
yeah.
right. You're
That
absolutely
makes
right.
it special. I love our probiotic. I can actually tell if I miss one. I take it morning and night, and if I don't take it, I feel a little irpy, just not so good, And it does help with elimination and helps with a lot of different things.
It does. It really does make a difference. And by the way, if you travel abroad, or even if you travel within the U.S., a probiotic is extremely important because every time you travel to a new area, you completely change the flora in your gut because the food changes, the water changes,
Gotcha.
etc. So making sure that you have the right flora becomes really important, especially
And this
if you
doesn't
travel.
have to be refrigerated.
No,
Many of the
no.
probiotics need to be refrigerated. This does not because of that special capsule.
Right,
So we're
because
very
of that
fortunate.
coating.
Yeah.
Excellent. Iodine. You know, iodine is the deficiency of iodine in this country is remarkable. After they took out iodinized salt, after they took out the iodine from bread and added bromide, the incidence of thyroid disease just skyrocketed. The amount of women, even men, are you seeing a lot of men with underactive thyroid?
Oh, absolutely. Absolutely.
It's incredible because a lot of it, not all of it, but a lot of it has to do with an iodine deficiency. Very interesting studies came out of Canada that showed that women with cystic disease, fibrocystic breast, fibrocystic ovaries, uterus, etc., they had big time iodine deficiencies. They gave these women iodine and the cystic disease essentially disappeared. There's a couple of other different things when it comes to iodine. Iodine also is involved. And by the way, iodine and DIM work very closely for women with regard to estrogen because it pushes estrogen down the right pathway. But iodine, I can't say enough about how critical it really is.
I've been recommending, I had a gynecology practice before hormones took over my life, and I remember I used to always recommend iodine to women that had uterine fibroids, ovarian cysts, fibrocystic breasts, all these things, even PCOS. It helps them feel better and helps these things get under control. You can actually kind of shrink them.
Right.
Yeah.
And again, thyroid. Right?
Oh, well, very
Women,
supportive for the thyroid. Yeah.
very important for the thyroid.
And the breast.
And the breast, exactly, exactly. Because selenium, iodine, zinc, they help the conversion of T4 to T3 because T3 is the active form of thyroid that does all the work, if you will, and that's where iodine really comes in. Methyl, the methyl factors, or this is basically a B complex. That's exactly what this is. It's a B complex. It's a B vitamin. The reason we say methyl is because 60% of the U.S. population, and what I'm seeing now is in the world, the people that I know you see people from all over the world, but I see people from all over the world, and I do their blood work. They have a deficiency or they have a break in their genetics that they can't change the B vitamins. If you just take vitamin B12 and it's the wrong form of B12, they can't convert that to the right form of B12. So what's the consequence of that? The result of that is memory, focus, concentration issues, nerve damage, heart issues. I mean, the list just goes on and on and on. It's called an MTHFR break.
Right.
And this, and I say this to people all the time. Why am I giving you something that's making your body work harder? Why don't I just give you what your body needs?
Right.
And prevent it from using more energy and going through all of this. Do and use what it needs. This is a methylated B12, it's a methylated folate, and other B vitamins that are in here. That's the key piece.
I call it my energy vitamin.
Yes,
Because if
yes.
you're suffering from fatigue, this can really give you a boost. And I just assume everybody has that break in their genetics
Exactly.
and have that MF THR or
Right,
fix the letters.
MTHFR, right.
But anytime somebody shows up low on their vitamin B12, I'll recommend that because all their other B vitamins are probably low as well, and that can give them a boost. You can take, I think, up to 1 to 3 a day.
Yes, yes. I mean,
Yeah.
I typically do one a day. And by the way, really important on the methyl in the morning. In the morning,
Right.
You don't want to take B vitamins at nighttime. That becomes really important. And also, I forgot to mention this before. I think I did mention actually. Vitamin D is in the morning because it's called the sunshine vitamin. You want to mimic the physiology of what the body is
Very
doing.
good.
Yes.
Okay.
I'm going to ask you about this sleep.
Yes, this is a magical sleep deep formula. We have many patients, almost probably about 80 or 90% that come to me. First thing they say is they have fatigue. And when I drill it down, it's because they're not sleeping well. And so we had to come up with something natural. I don't like Ambien. That can lead
Sure.
to dementia down the road. It has a whole host of things. So the prescription medications for sleeping are not good. So we put together a combination of natural herbs and things in here that will help you get that nice, delicious sleep. What I recommend and do myself is take 2 before bed, and you have to take it for at least a week before you judge it. But it really is worked. I'm selling it nationwide. People really like this combination. It's working for them.
Yeah, and again, it's sleep. I don't know if people really understand how important sleep really is. I think people say, yes, I don't sleep. I get up 2, 3 times at night, and they don't really don't get it.
Right.
When I tell people you need to sleep, you need to sleep. Sleep clears your immune system. Sleep, if you don't sleep, you increase your risk for heart attack, stroke, and cardiac arrhythmias, which is irregular heartbeats. People that don't sleep have all kinds of atrial fibrillation, all kinds of other cardiac issues. Why? Because you don't get that deep, restful REM sleep that you really need.
And without a good night's sleep, it's impossible to have a good day.
Exactly.
You
feel miserable.
We need to do that.
I mean,
yeah.
you really
Groggy,
feel miserable.
blah, blah, blah.
Right.
Yeah.
And you don't want to do anything.
Then you have to take methyl factors.
to pick you back up. Exactly. Exactly.
Free TE. I love this. And we came up with this supplement after I spoke with you, after we had recorded one of these, because I would have patients that would come in and I would optimize their hormones, and the numbers would be perfect on the labs. Perfect. But I don't feel anything. Uh-oh. Now what? What do I do now? Well, after speaking with him about this, about Long Jack,
LJ100.
LJ100. It's an extract from Malaysia, from a root from a tree. They realized that the men there that were making a tea out of this, an elixir, were very masculine and muscular and really feeling good. And what it does is it helps break up the bind. Testosterone tends to get attached to a protein that's produced by your liver, the sex hormone binding globulin. When it does that, your numbers are perfect, but you don't feel anything. So what this does is it breaks that bind. So you get a rush of the free testosterone, the bioavailable testosterone, so you feel better and you get the physical effects for it. So I tend to take 2 a day in the morning just to make sure I'm getting the most out of my pellets. I want to get my money's worth, even though they're
Absolutely.
mine. But I want the most out of my pellet possible. So I take 2 in the morning. Then you can add in another 2, half hour, hour before intimacy or exercise, and that'll ramp up and you'll get better effects from both. So I love the free TE. We sell this all over the country, and we have doctors and clinics that are buying it by the case from us because it's such a great product. So if you want to try it, we have some samples here in the office if you want to come by and pick it up, or just order one online. And then if you find that you're taking a lot of it, we have a wholesale option where you can get it for a much better price. But test it first, see if it's right for you, and then let us know.
That's the other thing that I think people need to know about is the pellets are phenomenal, right? The hormones are great, but there are certain nuances that you and I know that people that are doing it, if you will, on the street. Driving over here, I came down a major highway and I see the billboards. Yeah. Testosterone clinic here, testosterone this. These folks, it's scary to me. They don't do the blood work. They don't do the proper testing. Yeah. They don't know what they're doing. The wrong doses are being given. You have got to go to somebody that knows what they're doing. and the binding of testosterone. So I was at a reception last night for a group of people, and one of the doctors came up to me and he said, I'm doing these hormones. And he said, Derek, I don't feel anything. I said, well, what are you doing? And he went through the whole thing. And part of his issue is that his SHBG level, which is what you just mentioned, or the serum hormone binding globulin level, is too high because everything is being bound up.
Right.
And it's not free to do what it's going to do. So I said, get me the numbers, get me everything, let me take a look. But the doctor that's doing it had no idea, you know? And he's converting some of the testosterone to dihydrotestosterone, and he's losing hair.
Yes, that happens. What I find interesting about hormone replacement therapy is I look at it as filling a glass of water. And I want to give you enough to get you up towards the top so you get your symptom relief, but it doesn't spill over turning into dihydrotestosterone or estrogen for men where you have these bad effects. So it's a critical thing that we watch, and we just want to get you there safely. I start very slow. I'm very conservative with my dosing because I don't want to give you a flood of hormones and have you not feeling well. So I keep that glass of water in mind when I'm doing my dosing and all that.
Yeah.
So,
which is what I love about you. You know, I really love that about you. You start low and go slow. Because you can always give a little bit more, but it's tough to pull back.
yes, absolutely.
So, you know,
absolutely.
that's a great philosophy.
Alrighty, and so our next product we want to talk about is CitrusSlim. And CitrusSlim is an interesting product that we put together, and it has a combination of the free TE along with extract from an orange from Italy. And it's just crazy, bergamonte. And what this does, it helps with your appetite, number one. We pair it with our diet programs, but we have a lot of people that are just taking it on a daily basis to help with their appetite and their cortisol. So we take this, you know, a couple times a day. You just follow the directions on the back of it, and it can help you if you're working on your weight. So that's how we recommend it.
And I think the big thing when it comes to weight, folks, is that if you are not managing your weight, and by the way, and I tell my patients this all the time, there is no magic pill.
No.
You have to do the hormones. You have to do the right food. You have to hydrate. You have to exercise, and you have to sleep.
Yeah.
People who don't sleep tend to gain much more weight than people who sleep.
And it's more belly fat, right?
Exactly.
And is it the cortisol? Is that what we're
Exactly.
talking about? And that's what our solution is there for the cortisol.
And that's exactly what it is. But
Yeah.
make it part of your full total program,
Right.
if you will.
Right.
And you know, you're going to have much better results if you make it part of your whole program.
Yeah. And then finally, the last one is a 14-day detox. And the reason we brought this one in is because of my front desk girl wanted it. So we had to test drive it. And she test drove it and said it took away the bloat and she just felt better. And so it's always good to do a cleanse. How often do you do a cleanse?
What I do is I do a cleanse at the change of every season.
That's a good rule.
Yeah,
That's a good
because
rule.
and that's the way the Native American healers do it. So the change of every season, ideally, you change your food, right? Because every season
Right.
has their food.
Yes.
So what you want to do is you want to get the corn, you want to get the wheat out of your system from the summer or in the fall, and then start to introduce the winter foods, the spring foods, summer foods, etc. So for me, I do that, and it's a good, easy way to remember it.
Yeah,
is
absolutely.
The change of every season,
Yeah.
do a detox. The other time you should think about doing a detox is, again, I do a lot of international travel. When I come back, I really do something to get rid of
everything
the stuff.
you've
Just-
gathered.
right.
Yes,
just to
yes.
make sure. But detoxification, folks, your liver is that filter that nobody pays attention to. It's like the filter in your refrigerator or the filter underneath your sink. You don't see it, you don't pay attention to it, but it's critical. If you don't filter out the toxins, the environmental toxins, the pesticides, the herbicides, here's what's going to happen. I'm actually working with a researcher, actually in this area where you are. What he has told me is that people that are exposed to heavy metals, pesticides, herbicides, if they don't clear them out of the body, and that's through the liver, the kidneys do a good job, but the liver is the main filter, they end up becoming what are called neurotoxins.
Yep. That lead to Alzheimer's, MS.
Exactly.
Yeah.
Alzheimer's, MS, Parkinson's disease, all of those the neurotoxins, if you will convert. One of the classic examples of this is the folks that were exposed at 9/11. Now, I live in New Jersey, and where I practice, from my office to New York City is 20 minutes. So, a lot of my patients were first responders that were at the site at 9/11. It's sad. The amount of prostate cancer, I have 4 patients with Parkinson's disease that were at 9/11.
Yeah.
And I just didn't get it. I didn't understand. And after I spoke with this gentleman, when he started to explain to me the idea of neurotoxins and the lack of clearance from the liver, it made sense.
Absolutely.
So yes,
I think
detoxification.
everybody needs to do at least a 14-day detox.
Absolutely.
And along with that, eating your clean fruits and vegetables and, the healthy foods. Of
Absolutely.
course.
And really do the best you can.
Yeah.
Because, again, this is what I say to my patients. I was trained by the Franciscans, so for those of you who know St. Francis, I tell people, you don't need to become St. Francis. You just need to pay attention.
Yeah.
And I think you'll see a huge improvement in your overall health.
Absolutely. Well, thank you so much for
My
helping
pleasure.
explain all this. I mean, it's been a journey with you all these years. I think I started studying under you in like maybe 2013 or 14.
You're making me old, Carolyn.
No. We were teenagers. So, but I've really pretty much everything I know I've learned from you. I mean, and I truly appreciate it. You are my nutritional guru.
Thank you.
So thank you.
Thank
And I
you.
hope this explains why you left with a bag of supplements after you got your hormones fixed here at Low TE, Florida.